Americans do not die. We are in such denial about our own deaths that we have a difficult time even saying the word die. In fact, we use a plethora of other phrases in place of that. Here are just a few. We pass away, we expire, we become deceased, we meet our maker. We are in denial. Denial is a defense mechanism where unpleasant realities, like dying, are pushed out of our conscious awareness. Now, denial of death robs us of two things. One is the ability to live a life filled with gratitude. Every year I get a mammogram, and a couple of days later I'll get a letter that says the results are normal and please come back in a year. Last December I got my mammogram and I got my letter, and I had to read it twice because it said there were abnormal findings and I needed to call for additional tests. Well, this was the day before Christmas Eve, so when I called, they were closed Christmas Eve, Christmas, Friday, Saturday, Sunday, and the following Monday. 6 very long days. During those 6 days, I convinced myself, because I am a nurse, that I obviously had breast cancer. Every ache and pain I had in my body was a metastases, including my brain, because I was forgetful and I had a headache. Sounds pretty horrible, doesn't it? Well, not so much. What surprised me was that I kept thinking, this could be my last Christmas. And I thought of my family and friends, and I kept thinking, look at how beautiful this is. And I developed this deep, profound appreciation for the life that I was able to live. Well, the following Tuesday came. I went in for my follow-up exams, and lo and behold, I did not have breast cancer. I did not have any cancer. I was not dying of cancer. But what I have tried to do since that day is to hold on and embrace the fact that I am indeed dying, as are we all. And the feeling of gratitude that I obtained when I was no longer able to be in denial of my death. The second thing that denial of death robs us of is the certainty of a peaceful dying process. Now, I want you for a moment to picture your own death. And yes, you probably look like you're 150 years old, and that's okay. I really want to know where you see yourself dying. The vast majority of Americans will tell you they want to die at home. No one has ever said to me, I want to die in the hospital, I want to die in the ICU, I want to die in the nursing home or in the assisted living facility. The fact is, however, that of 500,000 deaths studied, 33% did occur in the hospital. 22% occurred in the intensive care unit. 1/3 of those that died in the intensive care unit had been there for 10 days or longer. 1/3 of patients' families that were interviewed stated that they believed their loved ones had experienced moderate to severe levels of pain at least half the time due to the life-sustaining treatments that they received. Now, how does this happen? Well, half of physicians, when surveyed, stated that they knew what their patients' wishes were for the end of their life. Now, if you are not okay with this, there's something that can help you. It's called an advance directive. An advance directive is a form that you complete that directs the care that you will receive at the end of your life. There are 2 parts to it. The first part is called the durable power of attorney, where you identify a person to make those decisions for you. The second part is called the living will. It goes into effect if you have a terminal illness where you are persistently unconscious, or you have an end-stage condition. It will ask you, the living will ask you to make some determinations that let us know when you think enough is enough. It will ask you pretty much what type of life-sustaining treatments that you want, or none at all. This is an important conversation for you to have with your family. It's an important piece of paper to fill out and to give to your physician and to your family members. Because honestly, Americans do die.